Good afternoon, everybody. Welcome to today's Apollo Hospital's Facebook Live session, your digital guide to good health. Cardiac diseases are a major burden to our nation's health. It's amongst the top killers in India, with several deaths associated with cardiac diseases. The incidence of cardiac diseases have also seen a sharp rise. To take this head on, we require a concerted effort from the medical fraternity, general public, and the administration. Awareness is the first step, and that's exactly what we're trying to do through such sessions. Today's session is about new age treatments for cardiac diseases. To speak on this, we have with us Dr. Rifai Shaukat Ali, Senior Consultant Interventional Cardiologist and Professor, Apollo Hospital's Educational and Research Foundation. Welcome, Doctor.
Thank you. Welcome for this.
Doctor, we're talking about cardiac diseases now. So what are the most common heart problems today?
I think we all know that the commonest heart problem, as most of you know, is the heart attack. And that is called the coronary artery disease. I mean, there are different spectrum of coronary artery disease, starting from mild chest pain when you walk, to up to the stage when you have a severe heart attack and ended up emergency at the hospital. These are the spectrum of heart problems you come across. But of course, there are other problems such as high blood pressure and contributing factors. There are heart-related muscle problems, and there are electrical problems that can also happen in the heart. And what we also call is a congenital heart disease, where we have heart problems starting from the birth. These are the different types of heart problems we come across on day-to-day life. But the most common nowadays also is valvular heart disease. Because of the aging population, we see a lot of patients who have valve problems over a late period of time, and the best treatment available is to be having valve problem has been growing so fast over the last couple of years in our country.
Thanks, Doctor. So these heart problems you've mentioned, who are at maximum risk of these heart problems? Is there any specific age group or a specific type of people who are more prone to these kind of heart diseases?
Yeah, so in terms of heart problems, I mean, we don't specifically go into one particular component of it. We have a risk factors of patients who can develop heart problems. Of course, being a male is a risk factor on its own, because female are protected by their hormones up to a certain age, and smoking, diabetes, high blood pressure, high cholesterol. These are the risk factors. And of course, now we see a lot of people who are stressed, emotional and physical stress, particularly in the younger population. We see these patients who can develop heart problem at a younger age compared to the older age as well.
Okay. So these risks which you've mentioned, are there any dietary changes which need to be done in order to to counter these risks, or are there like any lifestyle modifications which people can do to make sure that they are protected from these risk factors?
Yeah, see, I mean, we time and time again, we talk about lifestyle changes and making sure the dietary habits. One of the most common reasons for heart problem is the dietary issues. People, I mean, it's well-known fact there are certain group of people who are more prone for, particularly this coronary artery disease, those who have heart attacks. So the commonest thing we talk about is the lack of physical exercise. Particularly if you're not someone who does regular physical exercise on a daily basis, you have a higher chance of heart attack. And obesity, the body mass index, where you have a very high body mass index of anything about 25, where you're more prone for heart attacks and heart problems. And there are certain specific type of food, like, including cholesterol, even though there's a lot of debate and discussion about cholesterol. Until now, we know that if you reduce your cholesterol, particularly when you had a heart attack or something, you reduce the chances of further heart attack. There's no doubt about it. If somebody had a heart attack with high cholesterol, if you reduce your cholesterol, the chances of further heart attacks is much less. And then we have other issues like diabetes, which is India is kind of becoming the diabetes capital of the world, with more number of diabetics than anywhere in the world. And controlling diabetes is a very important thing. So, of course, you have to look after what you eat in terms of reducing your diabetes and making sure that you check your diabetic level at a certain time every few months and keep it under control to prevent heart attack. I mean, these are very proven studies have clearly shown that if you are a diabetic, you have high chances of having a heart attack than those who doesn't have a heart attack. And then again, it comes smoking. Smoking, even though it's much less nowadays, But still, it's the important risk factor for heart problem is smoking as well.
And what about alcohol, doctor? Does that also contribute?
In terms of alcohol, I mean, there are evidences to suggest that a little amount of alcohol is not too bad. It's maybe protective or to some extent, but the problem comes when your amount of alcohol exceeds a certain level. I mean, there are direct and indirect effect of alcohol on heart. I mean, in terms of direct effect of alcohol, you may develop what we call is alcohol-related heart muscle weakness, and the indirect effect because of the amount of calories you intake and also amount of food you intake at that particular time. There is a risk of metabolic syndrome where you have high cholesterol, and that can also have an impact on your heart, like coronary artery disease or heart attack can happen.
Okay, doctor. So in terms of symptoms, how can one detect that they're having a heart problem? Or because heart attacks is like something which is a complex issue. How can one make sure that he's safe in terms of cardiac problems, or he has some issues so that it can be picked up at an earlier stage and then it can be treated before it gets to a stage where it's like too late?
Yeah, so your question can include three components. What are the main symptoms of heart problems? We normally say most of us would have known the chest pain, breathlessness, swelling in the leg, dizziness or giddiness, and vomiting and sweating. These are all kind of typical symptoms. When you walk, you feel some tightness in your chest, or if you feel breathless, if you start to sweat, particularly in your minimal exertion, then that is something which will alert you that you may have underlying heart problems as such. Sorry, I missed your second question on the same thing.
Yeah, how can one make sure that, how can one find out that he's having a cardiac problem so that it can be picked up at an earlier stage, and so that it doesn't go too late where they end up in a heart attack or something like that?
So the typical symptoms which I mentioned about chest pain and breathlessness may not present in most patients. I mean, so even though this is very common in particularly younger age group, when you grow older and you're a diabetic and you're a woman, these typical symptoms may not happen. So people can have slightly funny symptoms. Some may have pain in the back of the chest, some may have pain in the left arm, some may have pain in the jaw. So these things can also happen. So what the important point we tell you is, if you are in doubt about the heart disease, particularly in an emergency, the first and foremost you do is an ECG. Then a simple electrocardiogram can pick up the worst form of heart attacks. So if you have any suspicion, particularly if you're a diabetic or if you have high blood pressure or cholesterol, you know that you're getting treatment for that. Then if you have any suspicious symptoms, it's better and check an ECG immediately. And that doesn't mean that the normal ECG doesn't mean that you don't have a heart problem at all. But the ECG can pick up the worst form of heart attack at that time. If at least that gives you an idea that you don't have an emergency heart attack at that time, you can pick it up. If it's not, then of course you can see a cardiologist or a physician the next day to assess your status in a little bit more detailed way. So what I'm saying is, even in the middle of the night, if you suspect that something is not right with you, better check an ECG first. So, and in terms of preventing heart problems, I mean, that's why we have health checks and all. I mean, unless you have your body checked every few years, depending on the age, about your cholesterol, about your diabetic or not, about your other blood test, and a simple ECG and echo, and the treadmill to some extent, you can pick up these things very early on, rather than waiting for the time when you have a heart attack. So these health checks should be done, particularly if you have a strong family history of somebody having a heart problem or you're a diabetic. These should be routinely done on every few years to make sure.
So how frequently would you suggest to have a health check done?
Well, it depends on the age of the patient, depends on the risk factors. So if you are somebody about, I mean, I used to say anybody above 40 in India should have a health check, because most of the diseases are not picked up at early because of your multiple symptoms. But now more and more of us seeing young patients coming to us. So I've actually myself lowered the threshold to 35 years of age. Anybody about 35 who has any family history of diabetes, I think it's better you start checking your heart early on. But if you don't have any risk factors such as diabetes or family history, then you can wait until 38, 40 years of age. But once you have your first health check, and if you come said nothing significant, then I would say anything between 2 to 3 years. But if you pick up something, I think it's best you check every year.
And Indians as a race, do you think we are more prone to this cardiac problems, or is it something like Asians? How does it work?
Well, there's enough studies to prove that even people, Indians or South Asians living in Europe or London or in the US, have higher chances of heart attack than those ethnic Caucasian population living there. And that's a very clearly data. So it's not just because the people who live in India, even if you're an Asian population who lives in Western countries, have a higher chance of heart attack than those people. So it's not the environmental factors; it's actually the genetic factors which has been into our system, which we are slightly prone for heart attacks. But if you look into that, the main reasons for that is because of the dietary habits we do. We are more kind of eating more of carbohydrates in our diet compared to the other populations, and then the lack of exercise culture, particularly in a country like where people are all working, trying to work and make their ends meet. There's not enough time for them to do proper exercise or physical activity on a regular basis. And then the work-related stress. Most of us are under stress at a young age, particularly in certain industries in India. There's a lot of targets, there's a lot of emotional stress, and those people are also more prone for heart attack. So it's a combination of your genetic factors and the environmental factors put the Indians at a more risk than other population. And being diabetic capital of the world, they have a higher chance of heart attacks than others.
So one of the main reasons why we've chosen cardiology as a topic, this is because of World Heart Day. It was like coming Sunday, 29th September. So just wanted to create awareness about this. So coming to the core topic of this session, which is about new age treatments for cardiac diseases. So could you explain about what are the new treatments available for cardiac diseases? Some things which were not available before, but now it's made life easier for the patients, and it's made treatment easier, and it's reduced pain and stuff like that. So could you explain a little bit more about that, Doctor?
I mean, we have an exciting time in treatment of heart diseases, particularly over the last 2 decades. So the whole process of treatment in cardiology is changed, where, of course, it happens in all the specialties, but it's much more rampant and vast and fast-moving specialties, the heart cardiology, where we have specialized treatment coming on a day-to-day basis for all the complex heart problems, which can be dealt in a very simpler way rather than undergoing a big open heart surgery. So let's start from the common things like what we call as the coronary artery disease. 15 years, 20 years ago, 10 years ago, you may have seen a lot of the people who had blocks in their heart undergoing bypass surgery, opening the chest, undergoing some bypass surgery, and then staying for at least 7, 8, 10 days in the hospital, and then waiting for 2 to 3 months for recovery. Things have changed now. Even in most complex coronary anatomy, we were able to do angioplasty, which is a procedure through a small pinhole procedure through the wrist in most of the times. You can open up the blocked arteries and the patient can go home within 24 hours and they can go back to their normal life as early as possible. So that's one part of it, but of course there are other things like the more complex procedures like valvular heart disease, where there's a degenerated valve, that we want to put a new valve and we don't need to open the chest to do that anymore. There are techniques and technologies available where in most of the situations you'll be able to replace a valve with special procedures like TAVI, where you put a small hole in the groin and pass a tube and replace the old valve with a new valve in the aortic area. So it's called the aortic valvular replacement without opening the chest. And that is similar. Valvular technologies are growing in the other valves, such as mitral valve, the tricuspid, and the pulmonary valve. There are technologies where you don't need to open your chest. You can go through the small nick in the groin and do the procedure in a very simpler way under local anesthetics, and the patient can be discharged in 24 to 48 hours, and they can have a normal quality of life after discharge. And one of the interests I do is particularly in TAVIs, where we put valves without opening the chest. And again, there are other things as well. Even in electrical problems, there are devices being used to pick up the data and also treat the problems as soon as possible, and without needing to open your chest. So it's becoming like a pinhole procedure for cardiac problems than opening the chest. It's not even a keyhole procedure. It's smaller than the keyhole. It's actually a pinhole procedure we do.
So you had mentioned about TAVI. So this is slowly becoming popular right now. And could you explain, is there any type of patients who are particularly suited to TAVI, or can anybody undergo TAVI? Is there any criteria for that?
Yeah. So when the TAVI was started, I mean, you remember the first TAVI was done back in 2002, and since then it's been progressing over the years, and in Western countries particularly, the number of TAVIs has grown dramatically. In India, we are picking up over the years, but I did a fellowship in TAVI back in 2011 in London, where we've been using more TAVIs even then. So, but at that time, we were only doing TAVIs for people who can consider to be a very high risk for surgical candidates. So, if somebody is considered to be very high risk for open heart surgery, we were doing TAVI. Things have evolved over the last 7-8 years. Now, the latest studies are telling that even in patients who are at low risk of surgery, can undergo TAVI and they have the equal results or maybe superior to by open heart surgery by replacing the valve with TAVI. So what essentially the criteria now is any patient with severe aortic stenosis, which is severe narrowing of the valve, can undergo TAVI without any problems. And that is what the guideline says. Even in low-risk patients who are considered low risk for surgery, but if the patient prefers to have a TAVI, we can offer it to them, because that is what the data says. But the initial stages when we started, it was only for those patients who are considered very high risk. But then we have more and more studies proving that it's equivalent or superior to open heart surgery.
We're recently hearing more about minimally invasive surgeries. So how is it different from the TAVI which you had mentioned earlier?
No, these are slightly two different technologies, because minimally invasive surgery is still a surgery. So they have to undergo a general anesthesia, and they have a nick on the side of the chest wall, and it's actually a small 3 to 5 centimeter hole. They have to put it opening the chest and then to replace it. Whereas TAVI is a little bit more fast forward, a little bit more newer technology, where we put everything through a small hole in the groin, so you may not even have a scar at the end of the procedure, and it can be replaced. So they're slightly different. Yeah, we use minimally invasive surgery for certain group of patients, and for certain group of patients we use TAVI. So that depends on the individual patient decisions and the patient's characteristics.
We have a question from one of our viewers who asks, what are the conditions which are normally treated from an angioplasty procedure, or when is an angioplasty done and what is its objective?
Angioplasty procedure is a technique where there is a blockage in your blood vessel, so it is completely different from valve. Valve is different, blood vessel is different. So angioplasty is a procedure to, when there is a blockage in the blood vessel, we go through the wrist under local anesthetic. Patient is fully awake. We pass a tube into the heart and then pass a wire and a balloon to stretch the artery open, and then put a small stent, which is like a mesh-like thing, to keep that artery open. So it's a very simple procedure for blockages in the blood vessels in the heart. It's one of the commonest procedures in cardiology at the present time all over the world. So you can do this for one vessel or two vessels, or even if you have a blockage in all three arteries, angioplasty can be performed. And depending on the complexity, there are different varieties of angioplasty, where we may need to take a little bit more higher risk of doing that, but most of the time, this is a very simple procedure through the wrist. So if people have chest pain on walking, you have treadmill test, is showing some problem, you do an angiogram, there's a blockage in the blood vessels, and then we do angioplasty to fix the blockage, so people can go home without any chest pain and they can walk around without any further problem. And this can also be done for acute heart attack as well.
Okay. And another question from one of our viewers, like, how does pacemaker help a patient, a heart patient?
So pacemaker is a device which takes your electricity out from your heart and give it to the machine. So essentially, pacemaker is a small kind of a machine with a wire attached to it, and the wire will go into your heart. And in patients who have some electrical problems, so when there are commonly elderly people who has like your normal house, you have a wiring problem in the house after a period of 15 years, 20 years, you need to fix the wire. So similarly, you can also develop wiring problem because there's electricity running in your heart. And you may have a problem with your electrical wiring in your heart, and if the wiring needs to be replaced, this is when we put pacemaker. So if your heart pulse rate goes down, or if you're feeling dizzy and we found that your heartbeat is coming down slowly, then the pacemaker can be helpful. So what it is it has a wire inside your heart and a small box attached under the skin, which we can put switch on that. So what this will do is whenever your heartbeat falls below a certain level, which we can adjust depending on the patient, this will kick in. So you will not have a collapse or fall down because of the low pulse rate, because the pacemaker will take over your heart electricity.
Thanks, doctor. We're constantly hearing about transplants being done. So heart transplants being one of the major transplants being done. So when does one go for a heart transplant, and what are the success rates and what are the risks associated with it?
So in terms of heart transplant, it's a well-tested technique. It's been there for so many years. I mean, even in India, it has been doing for the last 25, 30 years, heart transplant is happening. So what is any patient's heart muscles get weak. So that's essentially what we call as a heart failure. So the heart is actually a muscle which pumps blood out of your body. So like all your muscles, the heart muscle function has to function properly for the blood to pump out into your brain, into your kidneys, into everywhere. When there is a defect in your heart muscle, due to many reasons, of course, I don't want to go to the different reasons for that. There are plenty of reasons your heart muscles can damage or get weak. So when your heart muscle is weak, then your blood supply to the other organs comes down, and you may feel tiredness, weakness, so much of symptoms. When there is a certain level, we can fix the heart muscle by giving medicines or by doing angioplasties. At certain level, there may not be any specific treatment for heart muscle. In those kind of situations, what we say is, unfortunately, we cannot do much about your own heart. This is the time to think about heart transplant. So this is like a last thing for a patient when we feel that the heart muscle recovery is not possible, or the patient's feeling more and more symptoms despite their heart failure, then we consider transplant. So transplant on its own, again, as we said, it's been there for so many years. So it's been done for people, and it's been very time-tested procedure with a high success rate. I mean, we are talking about with 90% success rate, the procedural success rate as such. But then you have to be on certain medications after the transplant to make sure that there's not much rejection. So if your medications suit you, and if you suit well with the medicines, then you can have a good quality of life over the next so many years.
So how long would it be, doctor?
I mean, there's no clear-cut data to say that how long exactly an individual patient. But we have got patients who had a transplant 20 years ago, still doing extremely well without any major problem. So I would say that, I mean, if they are taking the medicines regularly, if they're doing well, and they should be able to live a normal quality of life for a long period of time. So it's a procedure we should consider when we feel that other treatment modalities have failed, and this time we can consider the transplant.
And how would you assess the suitability of a particular organ to the patient?
Yeah, so in terms of heart transplant, it's not unlike your other organs. There's only cadaver transplant. So somebody has to die for you to get their heart. Unlike your kidneys or unlike your liver, also nowadays they're doing live donor transplant. When it comes to heart, it's not possible. So in terms of heart transplant, there is a specific criteria for you to fit into the criteria. So if your cardiologist feels that your heart pumping is weak and you may need a transplant, then he will normally refer you to a transplant center. So what will happen is you'll be assessed by a team of experts considering your parameters from your echocardiogram, your other blood tests, and other things. And then once we feel that you are fit into the criteria that you may be successful to have a transplant, then we put you on a transplant list. And the transplant list has got a list of people from on the list. And once your particular availability of the heart is available, then you can be fit into, depending on your blood group, depending on the other parameters as well. So that will be on an individual basis. We'll decide at the time who would need a transplant and who are people who are eligible or on the criteria, and then we can put it on the list.
You had mentioned this earlier in your talk, doctor, that women are protected up to a particular age. So the question one of our viewers is asking is, do women have different symptoms during a heart attack?
I did say that women are protected, but this is a comparative term we use compared to men. But that doesn't mean that women don't have problems at younger age. I mean, that is what we are seeing more and more again. So far, we've been telling people that until the age of 50, women are more protected. But what we, on a day-to-day practice, we see is more number of patients, women, coming with heart attack, even at the younger age group. So they are catching up. I'm sorry to say, but that's what's happening. So even nowadays, we see women in their late 30s, early 30s, and 40s coming with heart problems. So in general, they are more protected than men in the early part of their life. But because of the other risk factors which we mentioned, the lifestyle changes and the environmental factors and the stress involved, particularly most women are working now, they also go to the same level of stress as men. So they are also more prone for heart-related problems. In terms of symptoms, what we say is women may not have your typical symptoms like what the textbook says, like a crushing central chest pain. We see, particularly in those people in their middle-aged or people or diabetic women, they tend to have unusual symptoms. They will not come and tell you they have a typical chest pain. They'll come and say that they have pain on the right side of the arm, or left side of the arm, or back of the chest, or they may saying that they feel a choking feeling. So when these kind of symptoms also can be worrying to have a heart problem. So if you feel that they have other risk factors, or if you have a strong suspicion, then they should be looked into for heart problems and such. Sometimes they may not even have pain at all. They'll just have episodes of sweating. Or some people may come and say, well, I just feel uneasy. They won't even explain to you what it is. They'll say, I'm not feeling right. So when a woman says uneasy, unusual or something, and if you feel there is anything risk factors involved, it's always better to check your heart as well.
We were talking about exercises to maintain a heart health. So what exercises are suitable or ideal for maintaining a healthy heart?
Yeah. So there are specific recommendations by the World Health Organization, and also now we have guidelines coming from the European Society of Cardiology. What is the form of exercise and what kind of exercise you should do and how much you should do. But one of the important things is it doesn't really matter what type of exercise you do. What we really need is you should do a physical activity, any form of physical activity, not necessarily walking or jogging. You can do jumping or climbing the stairs, nothing. So any form of physical activity of around 45 to 60 minutes per day for at least 5 to 6 days a week. So we used to say that 30 minutes, 45 minutes, 5 days a week of moderate intensity physical exertion. So when we talk about intensity, it's not your simple walking in the beach. It's not what or in your terrace is not considered to be a physical activity. When we talk about exercise and physical activity, we're talking about at least moderate intensity, or which essentially means a brisk walking or some form of exercise where your heartbeat goes up, where you feel that your heartbeat is going up and you can feel some sweating. So these are the form of exercises we should be doing, and it doesn't really matter what type of exercise. You can do skipping. If people like skipping, if people like dancing, they can do it. It doesn't really matter what's now. But at least do around 45 minutes to 60 minutes of any form of physical activity for at least 5 to 6 days a week. And that is what the recommendation says. And what it shows is when people who have physical activity at this level have a lesser number of heart problems than those who don't. So that is what we can say about it.
The next question is about blockage in heart arteries. So what are the causes for blockage in heart arteries?
So again, the same thing which we discussed about, the commonest medical cardiological problem or heart problem we come across in India is the blockages in the blood vessels. Of course, we have other problems, but this is the most common form of heart problem we come across. So the common risk factors are diabetes. People who are diabetic have a higher chance of having blockages compared to people who don't have diabetes. Cholesterol, smoking, lack of physical activity, and family history, genetics. So if a parent or if your brother, sister had heart problems, unfortunately, there is a slightly higher risk of having heart problem for yourself compared to those people. So the blockages are mostly caused by all these risk factors. I mean, we don't want to go into the details of what exactly caused the block. We tend to say that it's a cholesterol plaque, which is a lipid plaque. In other words, what we have seen that on the camera, we have facilities where we can put camera inside your blood vessel to check three-dimensional images of your blood vessel. And what it shows is it's just like a significant narrowing, mostly because of the fibrous or lipid, which is cholesterol plaque sitting there, which causes the more recent blockages.
The next question is about heart arrhythmias. So what is heart arrhythmias and what sort of treatment options are available?
So when it comes to arrhythmias, which is, I mean, as I said, the heart has got the electrical component in it and also the mechanical, the
pumping
flow and pumping component in it. So the arrhythmias is a term we use for people who have problems in their electrical component. So there are electrical wiring which is happening in the heart, and they are the starting point of the heart to pump. So the electricity starts the heart to pump. So it's actually, this is the electricity comes first, then your pumping. So if you have a problem with this electrical lining inside your heart, that is when we call arrhythmias. So it could be a bradyarrhythmias when your heart can go slow, or it could be tachyarrhythmias when the heart goes fast. So the common things we see is tachyarrhythmias when the heart beats go faster in certain people. There are many reasons for that. I mean, the main reasons is this is called a short circuit, that there's an extra electrical lining inside your heart, which can circulate, which can conduct electricity, and that can put the heart into fast rhythm. Or your own normal electrical activity itself will be faster because of your genetic factors. So these kind of electrical problems can be treated very easily nowadays. So what we have is an ablation procedure, where if you have a very fast heartbeat, we can identify where that fast heartbeat is coming from, and then we can do ablation. We can burn that with a laser type burn ablation procedure, and that will completely cure your problem. So you may not need to take tablets for long term if you have a fast heartbeat like tachyarrhythmia. The bradyarrhythmia is the one which I mentioned to you earlier. It's about when your heart goes too slow, you may need a pacemaker to put it and bring it back to normal.
So palpitations are the result of tachyarrhythmias, right?
That's most likely palpitations are related to tachyarrhythmia. It's very common in young women. So very in the late 20s, early 30s, women come with palpitations, and we do an ECG. We find some arrhythmias on the ECG, and then we discuss with them, and then undertake ablation procedures. We completely cure them.
Okay. The next question is about pericardial diseases. So what do they mean?
Yeah. So pericardial diseases, the pericardium is the lining of your heart. So heart has got pericardium, which is the outermost coverage of the heart, and then we have a myocardium, which is the muscle part, which is where the heart attack all happens, and then the endocardium, which is the inner lining of the heart. So anything to do with the outer layer of the heart is called pericardium. So in a country like India, the most common reason for pericardial diseases is because of tuberculosis. So TB can affect the pericardium, and they can collect fluid around the heart. So when you have a fluid around the heart, it's called pericardial effusion, and they can present with significant breathlessness, or they can even collapse with more amount of fluid around your heart, because it will stop your heart to pump normally. It's like a balloon sitting there in external pressure on the pumping of the heart, and the blood may not go out of the heart muscle, then the patients can collapse. So this kind of situation is an emergency where we just put a needle and remove that fluid from the outer layer of the heart. So the pericardial disease is common as tuberculosis. There are other reasons why people can develop pericardial problems, such as cancer, or sometimes radiotherapy. And some intrinsic viral can cause pericarditis, inflammation of the pericardium. And these are the causes for the pericardial problems.
We have another viewer asking about rheumatic heart diseases. Could you explain more about that?
Rheumatic heart disease is a term which has been much more common in India compared to the Western countries, and now even in India things are coming down because of the old style poor hygiene practices. The rheumatic fever, people develop rheumatic fever at the younger age group, where they have a certain bacteria which gets into your bloodstream and affect your joints and bones and cause fever. And unfortunately, that bacteria can also have a damage to your heart valves over a long period of time. So this is called rheumatic fever. But when people have rheumatic fever, they carry that small bug inside their body, and over a long period of time, that can damage your heart valves, and the heart valves can create as a problem at a later time. So that's the rheumatic heart disease. People have rheumatic fever at a younger age group who develop problems in the valves at a later date is called rheumatic valvular heart disease. Again, as we said, there are more and more newer technologies for rheumatic valve disease treatment, including the small pinhole procedures if you have a valve problem, even with rheumatic heart disease.
And what about ischemic heart diseases, doctor? Is it different from that?
Yeah, ischemic heart disease is the same, which I mentioned to you, is about the blockages in the blood vessels in the heart. I mean, that is called in general called as ischemic heart disease, and the rheumatic fever causing heart valve problem is called rheumatic heart disease. The ischemic heart disease is the most prevalent one in our country in terms of because of blockages in the blood vessels in the heart. So ischemic heart disease can be either even a heart attack comes under the ischemic heart disease umbrella. Or people have angina, which what angina means is people have chest pain when they walk, or people have breathlessness when they walk, and we do an angiogram, we find a blockage. That is called. That is also part of the ischemic heart disease umbrella. It comes in.
So we're talking about new age treatments, doctors. Apollo Hospitals as a brand is known for bringing in new treatments to the country and being the forefront in treatment of cardiac diseases. So could you tell our viewers why somebody has to come to Apollo Hospitals to get treated and what sort of new treatments are available here in comparison to other hospitals?
So let me start off with what we do on a day-to-day basis when patients come in. So we in Apollo is the only place where we have full-time cardiologists sitting 24/7. When somebody comes with a heart attack, even at 2 o'clock in the morning, we will be able to do an immediate angioplasty to open up the artery. That's the first and foremost. That's the commonest thing we do on a day-to-day practice. So unlike other hospitals where the full team is not available, we have a full team of cath lab technicians, nurses, doctors available round the clock, even cardiologists on round the clock. So if somebody comes with an acute heart attack, even at 3 o'clock in the morning, we will be able to do a procedure to open up your artery within the next 20 to 30 minutes of the arrival of the patient. That's the first and foremost thing. When it comes to technology, we have all the technology available. Whatever you have in any Western countries, we have all the technologies available in our center on site. So we don't need to wait for somebody to bring certain machines. We have machines already available. So when we talk about coronary artery disease blockages, we have the facilities of intravascular ultrasound where we can put a camera inside the blood vessel, or OCT is another form of camera inside your blood vessels, or rotablation where we have to drill the heart, drill the artery to make sure the stent. This is all available on site. There's no question of thinking about it, ordering it, or waiting for it. So any complex procedures in the cath lab are done in a manner that it is done anywhere in the world. We are far excellent in many of the situations with these kind of Western countries. So there's no question of wasting time or delaying things. And so any complex procedures, and we have a fantastic surgical team backup. So that's the most important thing for other reasons. If you have any complications or any small things that can happen, we have a backup team available to intervene and do procedures to fix the problem if there's need of it. When it comes to newer technologies, that is the next question you asked about, I think we are the highest number of valve replacement with the TAVI, and also we have procedures like mitral clip where we can fix the mitral leak in the mitral valve with a small clip, and we have the highest experience in the country in all these valvular heart disease program without opening the chest by doing small pinhole procedures. I think that's an important thing we need to highlight ourselves. And in terms of cardiac surgery, again, we are the highest number of cardiac surgery in the whole of country in terms of number of procedures wise. Cardiac surgery has been going on for so many years in this country. So you have very experienced cardiac surgeons, always there to back us if anything that happens in the cath lab. So I think we are so blessed to have all these facilities available in one umbrella, one place where we can do all these procedures without any. And that is the reason why I tell my patients, if you have any patient, any time, any chest pain, please come to Apollo. You treat you immediately rather than wasting time. And I think that's the crucial point I would say, that Apollo is so different from other hospitals. We have a fantastic team in the emergency department where we have facilities to pick up the problem very early on and treat them as early as possible to make sure that you get a better outcome. I think that's the crucial thing. It's the end of the day, it's the outcome which matters. And we also have proven track record of all the procedures being monitored very clearly, and we have a very clear database system where we can prove that most of the patients, the success rate is much more higher or equivalent to the Western countries compared to other hospitals in this country.
Yeah, thank you, doctor. As I mentioned earlier, we're doing this session for World Heart Day. So as an ending message, we've come towards the end of the session. As an ending message, what is the message you would like to convey to the viewers?
The World Heart Day happens every year on the 29th of September, and there is a specific theme for each year. And the theme of this particular World Heart Day is about taking a promise. So when we say it's taking a promise, it's taking a promise for yourself, for your family. So taking a promise to make sure that you do physical exercise on a regular basis, taking a promise that you eat proper healthy food, and taking a promise that you also check your heart. That is something which I add on, that you make sure that you check your heart on a regular basis at a certain age and make sure that your numbers are known, like your cholesterol levels, your sugar levels, your BP levels, making sure that you keep a track on that. I think that's the most important and crucial message I want to end up by giving this talk.
Thank you, Doctor. So I think our objective of this session is fulfilled. I think it would have created a lot of awareness amongst the viewers as to what heart diseases are and how it can be treated. Thank you for joining us for today. If you would like to know more about cardiac diseases and any further treatments, you can contact us on 97100 92401. The number is available on your screen, 97100 92401. So you can book an appointment with Dr. Rifai for a consultation if needed. Thank you so much for joining us. We'll meet soon in another Facebook Live session. Your guide to good health.
Thank you for your time and for listeners.
Thank you, Doctor.